And good morning, Dr. Deuk here, March 18, 2024, with one of my patients originally from Sarajevo, but now he's in Boston. And you came down to Deuk Spine Institute because you had some problems with your discs in your lower back. They were reherniated, degenerated, you've had back surgery before. Why did you come here to Deuk Spine Institute?
That's correct. First of all, thank you. Had a long history of lower back issues, had severe herniation about 4 years ago, and had microdiscectomy with laminectomy. Re-herniated it about a year ago, have had multiple steroid injections. None of that really helped. I was requested second opinion in Boston and a third opinion, and most of the surgeons that I saw in the Boston area said that either live with it, kind of deal with the pain management, or spinal fusion L4, L5. And I really didn't want to have a spinal fusion at the age of 45. I have 3 young kids, a lot that I want to do with them, and I found you online.
Let's talk about that.
Sure.
So this is important. They recommended an invasive surgery spinal fusion, but they also recommended it just at L4-5. But you had 2 discs that were the problem. So imagine what would have happened if you had the fusion at L4-5. Would you have been fixed?
Yeah, I didn't want to find that out.
No, because your L5-S1 was also a problem, right?
Yeah.
And you would have to come back and get the second surgery. And that's part of the problem, is the wrong diagnosis and under-treatment by other surgeons. That's one thing Deuk Spine Institute does not do. We get all your diagnoses and we can do all the treatments at one time. All right, well, carry on. What's life going to be like for you now that you've gotten your Deuk laser disc repair done?
Well, I'm hoping a lot more enjoyable and manageable. I've adjusted my social life significantly in the last year or so around the pain management, if you want. Removed a lot of activities that I enjoy. So I hope to be able to engage in those with my kids again. I know I've got a few weeks of healing ahead of me, but slowly, strictly following the instructions you provided.
More than a few weeks.
More than a few weeks, but 6 weeks of brace and up to a year of limited weight and whatnot. Beyond that, just kind of resume normal life if you want. And it's been difficult mentally as much as physical. I think a lot of people don't appreciate that pain management affects you often even far more mentally than it does physically. And those that are in your life, family members, get affected as much. So that's the part that I'm as excited about, that mental health as I'm about physical health.
Getting out of pain management, that's really key. Getting a definitive procedure that fixes your problem. Now, you came here with back pain. Do you still have that same back pain, or is it gone?
No, it's just the back pain is more localized from where the incision is and just a little bit of discomfort, but I sold it along. I sit here with you virtually pain-free as we speak.
Good job. And you can see the surgery here. We did it last week, so you're almost a week out of surgery. You can see the laser cleaning up the tears and the herniation. You had 2 discs that need to be fixed, by the way. Your surgery went perfect, and your incisions look great. Anything else you want to say to your family, friends, fans out there?
No, the same as many of the other patients have said. Do your research. Do not follow the first line of defense given to you by your local service provider, if you want. Just do your research. It's your back, and do everything you can to find the best care. I'm pleased I came to Dr. Deuk's Institute, and be happy to provide guidance and references to anybody that asks about it.
Well, thank you so much, and safe travels back to Boston.
Thank you, sir.
You're welcome.